Welcome to our In Focus discussion tonight on COVID-19 and Utah's inmate population. This week, the state health department announced that inmates could get the vaccine as early as March as part of a phase 2 of their rollout. Since the beginning of the pandemic, the Utah Department of Corrections reported more than 2,500 state inmates who tested positive for the virus. Earlier this year, their statistics dashboard show they had approximately 6,000 inmates in their care. Using these numbers, their positivity rate comes out to about 36.8%. As of Wednesday, there are currently 975 active cases. Advocates say correctional facilities are hot spots for the virus, with inmate family and friends fighting for better care and protocols. Tonight, we start our discussion with Cathy Linford, the mother of Calvin Hansen, who is an inmate at the Utah State Prison in Draper. Take a look. Cathy, thanks so much for joining us for the discussion tonight. Take us back to the beginning up until now. What has your experience been like trying to navigate through the COVID-19 pandemic during your son's incarceration?
Where do I begin? It's been horrible. It's been a nightmare for me and him both. As you probably know, he's in a promontory is a dorm. And so the bunks are bolted to the ground, literally 2.5 feet from each other. And so he couldn't socially distance. It's absolutely impossible. They gave him 2 cloth masks, and that's it. No PPE, nothing to clean with. They had a watered down solution of bleach. They are in charge of cleaning after somebody tested positive. They'd clean it up after they shipped them out. We were both petrified. Oh, he's gonna get it, he's gonna die, he has asthma. So I tried to get him an early release. I'd been working on it since March.
Now, you told me your son ended up testing positive for COVID on November 12th. What was that like for you, and how is your son doing now?
Those were the hardest 2 weeks of my life. I think I cried every single day. I didn't know if he's gonna live. I really didn't. You know, he'd call me. He still called me every day. Thank goodness he could still call me every single day. And I'm like, can you breathe? How are you? Are you okay? Okay, we can do this. And so we got through those 2 weeks, but he still, even now, has extreme difficulty breathing. We finally, after multiple emails, got him in to see a doctor because he still has such difficulty breathing, but turns out it was a PA. So I'm gonna push really hard to see if we can't get him an x-ray.
There are some people who believe that precious medical resources should not be allocated to those serving time behind bars. How would you respond to those individuals?
You know what? Those are people's loved ones in there. That is my son in there. That is my child. That is my kid. I don't care that he's a 30-year-old man. I will fight to the death for him. He is my child. There's somebody's husbands, wives, daughters, sons in there. People can have like a dismissive, harsh attitude all they want, but these are still our people, and everybody deserves kindness, and everybody deserves help. And COVID is a deadly disease, and thousands of men and women have been infected because they had no other choice. They couldn't get away from it. And if that doesn't create some empathy in people, I'm a little scared about society right now.
You've been fighting to get compassionate early release for your son, who has 10 months left on his sentence. You said he is considered low risk at level 4, but if that doesn't happen, what do you want to see improved inside the correctional facilities?
You know, give the prisoners some PPE. If they can't socially distance them, you know, I mean, geez, there's 50 men in a dorm. Is it a fire hazard? I don't know. It seems pretty high. But, you know, give them a chance to not get it again. They seriously, the people I've talked to up there, oh, yeah, we're on the end of this. It's over. Well, it's not over. COVID's still coming in. And like I said, you can be reinfected. So give them a chance to not get it this time. I don't know what that's going to look like, you know?
The health department announced that inmates could receive the vaccine as early as March, as inmates will be part of phase 2 of the rollout. Does this provide any comfort to you and your son, Calvin?
I certainly hope. You know, these incarcerated men and women are so vulnerable, and they can't do anything about it. They are stuck in there. And they're frightened. They're scared for their lives. And so maybe this vaccine will give them some comfort. I really, really, really hope that Utah follows through with it and that they are part of the second, what do they call it, rollout or wave or whatever. Yeah.
Cathy, I'd like to give you the final word in this interview. Anything that you'd like to say that I haven't asked you about?
I just don't know. I just hope his lungs survive. He literally has very difficulty breathing still. If he gets COVID again, I don't know. I just, wow, I can't even think of it. You know, I love my son. I love him so much. A mother's love is unconditional, but that shouldn't matter. Society should not be so harsh on these men and women, and we should be compassionate and help them through this deadly disease. Oh my gosh, I didn't want to cry. But you know what? That's my son in there, and I'm going to do what I can to help him and help everybody. I don't mind advocating for all of them.
Cathy, I know this wasn't easy for you, but thank you so much for joining us tonight and helping us provide that personal perspective to this topic. We really appreciate you being on the show and wish you the best.
Oh, thank you. Thank you very much. I appreciate it.
Coming up, the Utah Prisoner Advocate Network joins the conversation to talk about the unique challenges inmates face during the pandemic and why vaccinating this extremely vulnerable population is beneficial for the public. Stay with us for our next In Focus discussion. Thanks for staying with us for our second In Focus discussion tonight on COVID-19 and Utah's inmate population. Earlier, we heard from the mother of an inmate who tested positive for COVID-19 while incarcerated at the Utah State Prison in Draper. Now, we're turning to an advocate about what she's heard and observed from those throughout the state. Here's our interview with Wendy Parmley, Director of Medical and Mental Health for the Utah Prisoner Advocate Network. Wendy, thank you so much for joining us tonight and being a part of our In Focus discussion. Recently, there has been a lot of outcry from family, friends, and advocates regarding concerns about COVID-19 within prison facilities. Could you help explain why this population is more vulnerable or what circumstances put them more at risk?
Sure. Well, this population, as you know, a lot of them live in a dorm setting. And in that setting, there are multiple inmates who are housed together, and those bunks are 2 to 3 feet apart. Now, aside from their close living quarters, they also come with a lot of comorbidities and an awful lot of healthcare issues that are not maybe treated in the same way that you and I would treat them. Not that they don't go without their medications, but at this time of COVID especially, it's been more difficult. Diabetes, heart disease, asthma, respiratory conditions, COPD, that put them more at risk.
How do you feel state prison officials have handled efforts to mitigate the spread of COVID-19 within their facilities? Is enough being done?
I think that initially, especially, the state officials and particularly the prison officials really did their best to try to help mitigate the spread of COVID, providing masks for each of the inmates. And also I've heard from inmates who had janitorial jobs and things in the prison itself who were taught how to use bleach solution for sanitizing. I think that we might have been caught off guard as the virus spread as rapidly as it has. And it's really hard to make housing adjustments and quarantine adjustments to prevent the spread. The one thing that I think that we were behind the 8 ball in is that we, from what I understand, there wasn't routine testing being done at first. And so it was only when an inmate became symptomatic that then they were tested, and then the folks in their dorms were also tested. I don't know, I believe that's changed somewhat. The prison officials could share more, but once there are symptoms, it's too late. You, as we know, you spread this disease when you're pre-symptomatic.
Have you been in communication with inmates and or their families? And if so, what have they told you?
The general feeling is that they're forgotten about, and that their quarters are too tight. They don't understand all of the bed assignment changes. They feel like they're being housed, positive inmates with negative and that they're just sitting ducks. You know, these concerns are relayed up to prison officials, and I don't know exactly what happens from there. But my role is really to advocate on behalf of some of these inmates and their families. One of the really the most difficult thing is that visitation has been on hold since March. And for some reason, the rest of us were able to move forward with online technology, and the prison still doesn't have any sort of online visitation.
The health department announced that inmates could receive the vaccine as early as March, as inmates will be part of phase 2 of the rollout. Does this provide any relief or comfort to the inmate population and their families?
At least for family, it provides an awful lot of comfort that that inmates are being prioritized, as they should. They're in these congregate settings. They're at much higher risk than the general population to acquire COVID. And I think that it helps family members feel like their loved ones are important too, that they're not forgotten.
There's been some opposition to pushing inmates up higher on the vaccine priority list, believing that allocating precious medical resources to those serving time is unfair. What's your response to those with this perspective?
Well, I think that it serves us all well to vaccinate those who are most at risk. If you're most at risk to acquire COVID, you're also most at risk to then give others COVID, whether those be corrections officers or physicians who are coming in from outside the prison. You know, they go home to their families too. It's also the right thing to do. If you don't have a choice to isolate yourself and protect yourself because you're living with many, sometimes dozens of other individuals, it's the right thing to do to provide the immunization and to decrease your risk of acquiring a deadly illness. And we've had inmates die.
Wendy, I'd like to give you the final words. Anything else that you'd like to say that I didn't address in this discussion?
Sure. I'm so grateful that you are approaching this subject and really sharing the importance of getting our inmate population vaccinated, as well as providing appropriate medical care. I read one letter a couple of days ago where the inmate from Gunnison said, "I don't know what good this letter is going to do. We feel forgotten." And his desire was to be treated like a human being and not like animals, and felt like there wasn't any place for his voice to be heard. So I thank you from the bottom of my heart for sharing their voices.
It's been a pleasure to have you on the show. Thanks for carving out time today to talk to us, Wendy. We appreciate you joining our discussion.
Thank you so much. Appreciate it. You're wonderful.
Up next, we get to hear from a perspective from inside the facilities. The Davis County Sheriff's Office joins us to talk about how they held off COVID-19 for nearly 9 months and what receiving the vaccine would mean for their jail. Welcome to our third In Focus discussion on COVID-19 and Utah's inmate population. For this final segment, we turn to an inside perspective. Joining us now live via Zoom is Sheriff Kelly Sparks with the Davis County Sheriff's Office. Sheriff, thank you so much for being here tonight. We appreciate your time.
Thank you. Thanks for the invitation.
Sheriff, Davis County Jail is one of the last correctional facilities in Utah to experience a COVID outbreak in the state. Could you talk about what some of the preventative measures the jail took to help prevent the spread or the occurrence of the virus within the jail?
Sure, and I would like to just start with saying that I know every jail management team across the state is concerned about the spread of COVID in their facilities, and I think we've all been working hard to make sure that we mitigate that or stop that. At Davis County, we were able to provide masks very early on to all of our inmates so that the inmates could always have masks and our staff could always have masks. We've been doing that since about April. And we've got great compliance from our staff and great compliance from the inmates about wearing those masks. We've also provided some very strong disinfectants into each of the housing areas so that the inmates would have access to those disinfecting products and be able to use them on all of the common areas. Anybody who's come into our jail really throughout this year has been in a 2-week quarantine. So we don't introduce any new inmates into the general population of the jail until they've been through that 2-week quarantine and then Recently, when we obtained the ability to test inmates, we test them before that quarantine is over, and just doing all we can to make sure we keep the spread of that virus out of the jail as much as we possibly could.
Now, during the commercial break, you and I were talking about how some individuals think that when it comes to correctional facilities that people inside are just static. People don't come in and out, but that's not the case. Can you help provide a better understanding of this?
Yeah, I think people need to realize that a jail facility or a correctional facility is part of the community. We here at Davis County book routinely now 15 to 20 people a day, new inmates coming into the facility, and we'll probably release close to that number every day, either folks who have served their sentence and are due to be released, folks who are bailing out of jail or released from court orders, etc. So recognize and realizing that the correctional facilities are part of the community, and that folks who are in the facility go back out into the community on a regular basis, I think is important when you talk about why it's important to vaccinate inmates and why it's important to do all we can to prevent the spread of this disease in a correctional facility.
Now, has there been any considerations for compassionate early release to help drive down the number of inmates that are inside of your jail?
Yeah, and again, that was something that we started very early on. We worked with our prosecutor's office, Troy Rawlings, the Davis County attorney, with the public defender's office, with the administrative office of the courts, with various judges, and we looked at all of the inmates that we were holding and really targeted those who had served the majority of their sentence. We applied good time where that was appropriate. We identified those who were at risk, and there was some consideration for releasing inmates who were here for non-violent types of crimes. And so we were able to draw our numbers, total number of inmates, down considerably, which has been another important factor in keeping it out of the jail, because we have to have room to isolate individuals and to quarantine individuals. And so that's key as well. If we were at full capacity at our jail, we would have a much more difficult time controlling the spread of the disease into the main population of the jail.
Now, Sheriff, we have about a minute left. The State Health Department did confirm that inmates will be part of Phase 2 of the COVID-19 vaccine rollout. What does this mean for correctional facilities like the Davis County Jail, and does this provide some relief for your agency?
Yeah, I think it does provide some relief for the agency. I think one of the things also that is on the forefront of my mind often is our staff, our employees who work in the jail. Our employees have to go into those confined spaces and work daily with our inmates. And so if we can vaccinate the inmates and prevent this disease from spreading within the jail, that also helps us protect our staff, and that's extremely important. And our staff go home to their families every day. So I appreciate some of the voices that have been expressed already on the program. I think it's important to hear the experience of loved ones of inmates and also those who are advocating for inmates. I think when all those voices come together and we consider all points of view, we make the best decisions. So I appreciate that.
And we want to thank you for everything that you and your staff do. Whenever we have law enforcement or first responders on the show, we always like to take an opportunity to thank you for what you do. You guys are our frontline workers, and you expose yourself to, very vulnerable conditions. So thank you for that. You've been hearing from Sheriff Kelly Sparks with the Davis County Sheriff's Office. Sheriff, thank you so much for helping us get an inside perspective in this conversation. We really appreciate your insight.
Thank you.